Pertussis, also known as whooping cough, is a highly contagious respiratory disease caused by the bacterium Bordetella pertussis. It gets its name from the distinctive whooping sound patients make when gasping for air after severe coughing fits. Pertussis primarily affects the respiratory system. It spreads through droplets when an infected person coughs or sneezes. While it can infect people of all ages, it is especially dangerous for infants and young children. The disease develops in 3 stages. Catarrhal stage, 1 to 2 weeks. Symptoms resemble the common cold: runny nose, mild cough, and low-grade fever. Paroxysmal stage, 2 to 6 weeks. Severe coughing fits, vomiting after cough, and the signature whooping sound when breathing in. Convalescent stage, weeks to months. Symptoms gradually decrease, but coughing may persist for weeks. Pertussis can cause serious complications such as pneumonia, seizures, brain damage, and in some cases death, particularly in infants under 1 year of age. Doctors diagnose pertussis using medical history, physical examination, and laboratory tests such as PCR or culture from a nasal swab. Early treatment with antibiotics, such as azithromycin or erythromycin, can help reduce severity and prevent spread. Supportive care, including oxygen and hydration, may be necessary in severe cases. The best protection against pertussis is vaccination. The DTaP vaccine for children and the Tdap booster for adolescents and adults are highly effective in preventing outbreaks. Pregnant women are also recommended to receive the Tdap vaccine to protect newborns. Pertussis is a serious but preventable disease. Vaccination, early diagnosis, and treatment are key to saving lives and stopping its spread. Protect yourself, protect your family, and protect your community.